Let's go to Al.
I have a problem with this whole thing. Number one, I've been coming here for the last 2 years, and I've been vocal about this, and I appreciate everyone here, and I appreciate you at the panel listening to us and being there for us and fighting for us. But the problem is that all of our discussions here are academic. You know, if we don't get some kind of public support, some kind of information out there to the public to be on our side. We've been villainized by the Obama administration, started even before he was in office. Nancy, the people that were running for office villainized us. They said that the prices of healthcare are so high because it's the doctors who make so much money. I'd like to remind you all, doctors' salaries have been frozen for almost 20 years. When I got out as a resident, our starting salaries were $135. I hate to tell you what they are now. They're basically the same. But now we have to work twice as hard. We have to jump through so many hoops. We have to do so many things. And yes, many of us make more than that, but it's only because we work twice as hard. We do twice as many hours. We do twice as much call, and so on and so on. No one in the public understands that. If we would tell a post office worker or a bus driver, say, hey, how would you like to have the same salary you had 20 years ago? They'd laugh at us. And yet, we are being the scapegoat for this whole debacle. We are the ones who are being told that we are the cause of the expensive health care. However, we are not. When we look at the prices of health care, even Medicare, there's many different calculations as to what percentage of the Medicare dollars go for doctors. But one of our members came out last year and said, it's 6%. 6% of the budget goes to pay our salaries. And yet they're going to save all this money, and they're going to cut us by 30%, and they expect young people from college who really want to have a career. And a career is actually two things. It's a good job, and it's something you do and are. It's not something you go and get and you work manual labor for $10 or $15 an hour. It's a transformation of the person into something. We all did that. We committed to become doctors. We worked very hard. Most of us were at the top of their class to be this physician. Why? Because it has a tremendous amount of responsibility. With it, it should have some type of compensation. And yet, that compensation has not been looked at. That's why we can't get young people to become doctors anymore. Because they can go out and they can go into business, make 3 times the money for half the work. It's ridiculous. Nobody appreciates us. My fight in what we do with our organization is to get the word out to the people. Talking to you is preaching to the choir. What we're doing here is wonderful. It's all internal, however, and it's all academic. If we don't get this word out to the public, to have them support us. I do with my patients every day. I've encouraged every doctor who's gone onto our website to speak to their patients.
Amen.
That's something we can do today. Just explain to them what's going on. Give them the economics. Obamacare. If we don't get rid of Obamacare, we're not going to have this conversation next year. We're not going to have a reason to come here. That's how important this is. And when we speak to our patients, when I speak to a doctor, he can understand because it's going to threaten his livelihood. It's going to threaten his position. It's going to threaten what he does for his patients. And above all, that doctor fears that it's going to affect the quality of care that his patients receive. We're very noble people. Our profession is probably the most noble of all professions. We work very often in an altruistic way. Sure, we want to get our bills paid, we want to have our lives. But there's no other profession out there that does as much charity work. I know I do. Every one of you can say that between 15 and 20% of the stuff that you do is for free. Nobody reimburses you for that, and nobody even pats you on the back for that. What I'm saying here is that we need to really get out there, explain to our patients how it's going to affect them. Well, how is it? First of all, confidentiality is gone. If we can't protect our financial records that we send to the IRS because they're going to be bamboozled by some guy in Russia who's hacked into the system and now he's using our social security numbers and our bank accounts to just whittle a couple of dollars here, you won't even notice it. How can they protect the privacy, truly, of our patients? The best way is to never let them have it. Never let them have the information. Why should they know whether my patient had 3 hemorrhoids versus 1? It doesn't matter to them. The other thing is this. The patients, the people out there who are not in the medical profession have to understand how this Obamacare is going to affect them personally, and the best way is to explain to them how it's going to affect their pocketbook. We've talked about this on our website so many times and on Facebook, everywhere. Obamacare is just the tip of an iceberg. Right now, it started out as $900 billion, now it's $2.5 trillion, and then it's going to end up being $10 trillion by the time it's done. And most people don't understand how many people can be working under Obamacare. It's going to be hundreds of thousands of people. They've said that they wanted to have 20,000 new IRS agents. Do you ever wonder how much an IRS agent makes? They make over $100,000 plus their benefits. How much is 20,000 times 100,000? Calculate it. It's into the billions every year for their salaries.
And their pension.
Their pensions. When we start growing this government, this whole cancer, how is it going to affect our economy? Those people may not understand how it affects our lives because they're not physicians, but they will understand how it's going to affect their own lives personally, financially. I always tell people this. Some people have calculated that Obamacare is going to encompass 1/6 of the U.S. economy. Well, that's a nice little number. Nobody understands what that means. First of all, if I may, that's 2 minutes and I'm done, a little bit about international economy. Here it is. The U.S. economy is the biggest on the planet. Nobody comes close. The second most, or the biggest, is Japan, and it's only 1/4. The next one is Germany at 1/5. And guess what? 1/6 of the economy is China. 1/6 of our entire economy is the entire Chinese economy. Obamacare is that. How can we, as a nation, absorb the entire economy of China under the federal wing and expect for us to pay for it? When I explain this thing to the common people out there, their eyes are wide, their mouth drops, and they say, oh my God. And then once they realize they're not getting any better health care from this law, they're advocates for us. What we need to do here is every one of us is a leader. Go out there, speak to your patients, speak to your colleagues, even if they don't want to listen to it. Believe me, there's a lot that don't want to. I speak to people until I'm blue in the face, and they say, oh, it's not going to be that way. I said, it is. The reason why you don't think it is because you haven't educated yourself. So encourage them to educate themselves. Let them learn. Grab the law, read it yourself, figure it out. Speak to other people and become an advocate. Don't let this happen. If we fail this year, I'm sorry, we won't meet.
Let me just ask you a question.